Hello, I'm Dr. Vivian Bellofatto, and I'm the current chair of microbiology at Rutgers, New Jersey Medical School. And my research is focused on infectious disease. What we're going to talk about today are the mosquito-borne infectious diseases, and we're going to debunk a lot of the myths that people have about mosquitoes and mosquito bites. The first myth I want to debunk is that people feel that they're bitten by mosquitoes because they have sweet blood. And in fact, there's no such thing as sweet blood. The mosquitoes, the female mosquitoes, actually bite you because they're not interested in the sugar in your body. They're interested in the protein in your blood because they want to use that to feed their offspring. What mosquitoes really do like, though, is a person who's just finished exercising. Because, as you know, when you've just finished exercising, you're breathing heavily, so you're exhaling CO2, and the mosquitoes love that. You are sweating, and so you're producing more body odor, and the mosquitoes absolutely love that. And you're producing lactic acid in your muscles, and mosquitoes are quite attracted to that. Another myth I want to debunk is the idea that the bug zappers in our backyard actually control the mosquitoes in our yard. And they don't. The bug zappers are great for killing other insects, but they're not so great at killing mosquitoes. We all like citronella candles in our yard. However, the citronella oil really doesn't remove mosquitoes from our environment unless you're basically sitting on top of the citronella candle. What you can do, though, to keep mosquitoes off of your body is to use a good insect repellent and to keep screens on your windows in your house. Naturally, people often ask me what they can do about a mosquito bite. Well, when you've been bitten by a mosquito, the first thing you really ought to do is wash off that bite with soap and water, because that'll remove the saliva that the mosquito has left on your skin. Second thing, to decrease swelling, is you should put a cold compress on the location of the mosquito bite. And finally, calamine lotion is fantastic for stopping the itch that mosquito bites cause. There are a large number of mosquito-borne infections that are out there, but we're going to focus on West Nile today because West Nile virus, carried by mosquitoes, of course, is really the most prominent type of mosquito-borne illness that we see in the continental U.S. And in fact, the amount of West Nile has actually been increasing both in the United States and equally importantly, in New Jersey. However, if you're bitten by a mosquito that's infected with West Nile virus, chances are you won't even know that, because 8 out of 10 people that do get West Nile virus from mosquito bites are not symptomatic. But those 2 out of 10 that are symptomatic are going to feel like they're getting a cold. They're going to feel that they have a fever and malaise and maybe a headache. So if you feel that way, I strongly suggest you go to your primary care physician. She can do a really simple blood test to determine if you have West Nile. And if you do, the doctor will simply keep you under his or her care until the virus works itself out of your system. However, you should be concerned about West Nile because 1 in 150 people, which isn't really all that few, do end up with major disease problems and need to be hospitalized. Therefore, it's always good to check if you have West Nile virus, if you're feeling symptomatic. Now, you may be wondering what we're doing at Rutgers, New Jersey Medical School to control and conquer mosquito-borne infections. Research teams work on a variety of mosquito-borne infections, all with the intention of controlling these infections as well as curing and preventing these infections. For example, we have 2 research teams working on malaria, which is the most prominent mosquito-borne disease, and both of those teams are working on ways of developing our immune systems so they work better to control malaria infections. And the plan is that these measures will also be useful for controlling other mosquito-borne diseases. So where can you go to find out more about mosquito-borne illnesses? First, I suggest that you go to the CDC, which is the Center for Disease Control website. Secondly, it's a good idea to go to your state's Department of Health website. And finally, you're more than welcome to contact us, and we'll certainly chat your ear off about how to fight the bite.